And welcome to Onetake. My name's Nolan Kuhn, and Onetake is a series where I explain to you PT and NPTE concepts in only one take. So today we're going to be talking about the Wells criteria. So you may be thinking to yourself, what the heck is the Wells criteria? Now, the Wells criteria is a prediction, rule, and guideline set to predict a patient's risk of a pulmonary embolism or a blood clot getting into the lungs. So the scoring for the Wells criteria is based on these numbers here in blue. Now the scoring for this is anything less than 2 is a low risk for a pulmonary embolism, 2 to 6 is a medium risk, and 6+ is a high risk for a pulmonary embolism. So these are the point values. So if the patient has classic DVT signs and symptoms, which would amount to swelling, redness, and tenderness to palpation to the calf, that automatically gets you 3 points. And if other diagnoses are unlikely from a cardiovascular standpoint, like arrhythmia, COPD, heart failure, if those sources are unlikely and it's pointing to pulmonary embolism, that also gets you 3 points. Tachycardia or heart rate over 100 beats per minute gets you 1.5. Any immobilizations or surgeries within the past 4 weeks also gets you 1.5 points. Previous DVTs or pulmonary embolisms, 1.5 points. Blood in the sputum or hemoptysis gets you 1 point. And malignancy or treated cancer in 6 months, within the last 6 months, also gets you 1 point. Patients who are also on home palliative care also qualify in this category. So if you use this criteria and your patients score within the 2 to 6 range and they have an increased risk for a pulmonary embolism, that clues you in as the physical therapist to be more on alert and collaborate with the medical team to evaluate the patient's risk for a pulmonary embolism. Thank you for listening, and this has been Onetake.